Hello everyone, I am Dr. Priyanka Mohan. I am a fertility consultant at Cloudnine Hospital, Sarjapur Road and Bangalore, Bangalore. Saline Infusion Sonography, which is SSG, is a test commonly done to assess the tubal factor, to assess if there's any blockage in the fallopian tube. But along with the fallopian tube blockage, the uterine health also can be assessed with this particular test. So what we are doing here is that we are injecting saline into the uterine cavity under ultrasound guidance. And as the saline fills the uterine cavity, if there is any defect in the uterine cavity, it can be visualized on the scan. So there's another modality called HSG, Hysterosalpingography, in which we use a dye a contrast dye instead of using normal saline, and an X-ray image is taken. Here also it is the same principle. It is to assess the blockage in the fallopian tube, but along with that the uterine cavity also can be assessed if there is any irregular filling of the uterine cavity by the dye, which can be seen on the X-ray film. Thank you.